So you were told you have high cholesterol and you are not sure if you should be on a statin. On series 2 of this cholesterol series, I go into when statins are appropriate to be prescribed for a patient and when they're really not. Believe it or not, there are guidelines from the American Heart Association of when to prescribe a statin, when to not. But I wanted to go over what if you have genetically high cholesterol? It's been passed down through your family. Like there's nothing you can do. You just have high cholesterol. Well, we're going to go over that. And let's go over first why cholesterol is so important for brain health. That's right. So cholesterol makes up our brain cells. That's right. It includes covering the cell membrane in this layer that maintains the membrane fluidity of the cell, permeability, overall integrity. You want a strong, healthy brain. In the brain, nearly all cholesterol is synthesized locally due to the blood-brain barrier preventing entry from blood, ensuring a stable supply for neural functions. Isn't that interesting? It's essential. Cholesterol is essential, get this, for myelination. This is forming that myelin sheath or that protective coating over our nerve fibers. You think about that, people that have damaged myelin sheaths. I think about someone that has been exposed to virus and pathogens, even the multiple sclerosis patient, right? Because they have damage of the white matter and they're getting nerve damage. Some diabetics getting neuropathy, again, they have nerve damage. So what is statin going to do to that? Yeah. And so that's why you want to go back and watch the second video about that. But anyway, cholesterol is essential for forming those myelin sheaths that coil and wrap around our nerves. So this is really important for nerve signal transmission. You have a thought, you want it to go to another part of the brain and have a thought, or you are feeling a sensation at the bottom of your feet maybe, and you want to feel that pain to know you're stepping on a nail. If you can't feel it, that signal's not going to get to the brain. That's why cholesterol is so important for our nerves. Depletion of cholesterol in the neuronal and the brain leads to degeneration of synapses, and this leads to overall decreased brain function. It's so important. Okay, well, let's talk about the genetically high cholesterol individual. Okay, so it's been passed down. Your grandmother had really, really high cholesterol, but she lived to age 90. So it's called familial hypercholesterolemia, or FH. It is a genetic disorder that causes high LDL. So, you look at your blood results, your doctor's like, well, your HDL is great, but your LDL is really high too. And I don't get it because you're an athlete and you run marathons. Why is your LDL so high? Well, you might have genetic high LDL. So it's mild with early detection and lifestyle management and may not lead to severe outcomes in all cases. And I remember when I was 10 years old, and I don't know why I was tested for cholesterol when I was 10 years old by my pediatrician, but apparently I had really high cholesterol. So I think I'm one of those genetic carriers too. But, I try to maintain a healthy weight. I exercise, I eat right, so I try to do what I can. So not all genetic high cholesterol is familial. There's a thing called polygenic hypercholesterolemia that involves multiple genes and can result in elevated cholesterol levels. But it responds really well to diet and exercise. That's great news. And so without a high risk of cardiovascular disease. Love that. So that's why it's so important to, if a medication or statin isn't working on someone that's been placed on it because it's been determined they have this genetic type, well, yeah, lifestyle, diet, that can help. So high cholesterol from genetic causes is not always harmful if accompanied by a high HDL. Remember, we say the healthy cholesterol is HDL, so we want that above 45 also. We also have to look at triglycerides because if you have high LDL, but your HDL is high and your triglycerides are low, you're kind of in a good spot right there. But if you have high triglycerides, that does put you at more risk for a cardiovascular event because, again, that is definitely going to build up plaque. High triglycerides really, and on a blood work, it may say TG, but that is someone that's eating way too much sugar carbohydrates, probably alcohol too, or not, just high carbs and high sugar. If I have an insulin resistant patient, which means they're not quite diabetic, but they're eating carbs, they're eating sugar, their insulin's through the roof, most of the time their triglycerides are elevated too. Most doctors will put their patient on a triglyceride lowering medication once those triglycerides are over 400. However, a lot of times in my office, I'll see patients at 150, 200, and you can bet we have a discussion about high fiber, avoiding sugar, avoiding carbs, walking every day, things like that. So, genetic testing can identify variants where high LDL cholesterol levels does not translate to buildup of plaque in the blood vessels. And that way we can tailor treatment. We don't just throw everybody on a statin. So it means elevated LDL levels alone do not, I repeat, do not doom everyone to heart disease. Isn't that good news? Yeah. So again, if you're really wrestling with the idea of being on a prescription medication for your elevated LDL, maybe talk to your doctor about genetic testing if they're familiar with it. You can actually go online on your own and research the labs that do it and present that to your doctor. You could do that too if they're not familiar with it. So in managed familial elevated cholesterol situations, remember, high cholesterol isn't bad if other therapies like lifestyle modification diet or even sometimes statin can mitigate and normalize the risk. So this can allow for a normal lifespan. So untreated though, familial high cholesterol can increase heart attack risk. But genetics don't guarantee this. They don't guarantee a poor outcome. So I think it's always about getting your body in the healthiest state it can be. Watching your sugars, your carbohydrates, increasing your fiber, increasing your activity, increasing your healthy fats like your olive oil, your fish oil. Talk to your doctor about all these things. But I wanted you to be educated to know that there's different types of high cholesterol, genetic, lifestyle, diet, and not everyone needs to be on a statin, okay? So thank you for joining us on this cholesterol series. I'm Dr. Andrea O'Connor, and this is Vitalize Health Partners, and we'll see you on the next one.